I see from your opening statement, Ms Edwards, you said the Australian National Incident Room was activated on the 20th of January. Professor Murphy, can you inform the committee of when and how you became first aware of the corona outbreak in Wuhan province?
Certainly, Senator. So we first heard notification through the WHO on New Year's Day on the 1st of January that there was a cluster of pneumonia of unknown etiology in Wuhan in China. And we watched that over the first week. I think in the second week of January, the advice coming out of China was that there had been no more cases for a week and that there was no evidence of human-to-human transmission, and at that stage it was thought to be what we call a zoonotic infection that seems to spread from an animal to a human but not spread widely amongst humans, and that was the advice coming out of China. But around the 19th and 20th of January that all changed, and there was very clear evidence coming from China that there was significant human-to-human transmission, which was game-changing. If you've got a virus which doesn't spread from human to human, it's very easy to contain. Once you've got human-to-human transmission, it becomes a significant risk. And that's when we activated our NIR and we started our essentially daily meetings of the Australian Health Protection Principal Committee, which is our national committee comprising all the chief health officers, a range of expert advice. And we set up a working group with what we call our communicable diseases network, and we started discussing with our international counterparts. From about the 19th or 20th of January, we were in an active response mode. We declared this a listed human disease under our Biosecurity Act a few days later. One of the first countries to do that because we recognised the pandemic potential of the virus.
Okay, thank you. And so between the 1st and the 19th or 20th of January, you say you were in more of a watching mode.
Correct.
Could you just elaborate a bit on what that means?
We were getting data out of the WHO from our counterparts in other countries, the CDC. We were trying to get intelligence, but all of the data coming out of China suggested that there'd been this cluster of cases, and then there were about 43 cases, and then they said there had been no new cases for a week and all cases had come from animals. So it was a very different position once it was acknowledged and recognised internationally that there was human-to-human transmission of a significant degree.
And on the 19th or 20th, you move into a more formal mode, which we can come back to. But between the 1st and the 19th, were there any sort of formal escalation occurring across health and out to the states and territories?
There was discussions through our communicable disease network around the intelligence and the information we had. You need to recognise, Senators, that there are quite often small outbreaks of zoonotic infections. We've seen these with avian flu, we've seen them with other things, and these happen, every couple of years, and we obviously watch and wait. We knew that we were well prepared for a pandemic because we've had long-standing pandemic preparedness plans based around flu pandemics. So we were just watching and waiting to see whether this developed and whether we needed to activate our well-established and existing plans.
So in response to that initial your notice on the 1st of the 1st, I think you said that came from the WHO.
Correct.
Did you take any specific actions as Chief Medical Officer in response to that report?
I took actions. I was on leave at the time. I came back in the second week of January and I had a briefing and that briefing at that stage was, as I said, that there'd been this report of a cluster of cases that the Chinese authorities were assuring that there weren't human-to-human transmission and there were no new cases and had been none for a week. So at that stage, we decided to keep pursuing our intelligence sources and watching. There was nothing to suggest at that stage that we were in a high risk of pandemic, but we were watching closely.
Could you indicate at what point you provided briefings to the Health Minister and or the Prime Minister about some of these events that you were watching?
I think I have to go back and check, but I think I've informally briefed the Health Minister during that period when we were watching and waiting, and described that we were waiting to see whether there was any evidence of human transmission. I don't think we briefed the Prime Minister. I don't think internationally the level of concern was particularly high until about that time on the 19th and 20th of January when human-to-human transmission was clearly demonstrated.
Okay. And so can you recall when you initiated briefings more formally to the government?
On the 19th of January,
It was on the 19th?
We really, once that new information was in, we moved into a very different mode.
And that was briefing to the government to alert them to the information you had and that you were establishing the Australian National Incident Room?
Well, activating. The incident room is well established. It's activated on many occasions. It was actually already active for the bushfires, but we set up a whole range of new teams, moved it into a much more focused operation in terms of this pandemic.
When were you first asked to brief the Cabinet?
I imagine it would have been in the week, because let me just have a look. Yes, it would have been, I think I briefed the National Security Committee of Cabinet on that weekend around I'd have to go back and check that, Senator. I better take it on notice, but we certainly raised the travel advisory because we'd made recommendations through Cabinet around the 22nd to 23rd of January. I don't have a record here of when I formally first briefed Cabinet. Most of my briefings have actually been to the National Security Committee of Cabinet, and I've briefed Cabinet on its full Cabinet on 3 or 4 occasions, but I've probably briefed the National Security Committee of Cabinet 2 or 3 times a week since that pandemic situation evolved in late January.